Also, women who did not want the pregnancy, or they are ambivalent towards the pregnancy, they also have an increased risk. And those who do not also have, who have a challenging relationship with their own mother, I guess that when they have a baby, we model a lot of our parenting and a lot of our relationships. We model it on what we had when we were growing up.
Okay.
So for women who have a challenging relationship with their mothers prior to pregnancy, when they find themselves in that role as a mother, it can trigger. It can increase their risk of postnatal depression.
Okay, so in your line of practice, have you come across people who have such things, and then would they think that because they had a challenging relationship with their mother, they are scared they may have that kind of relationship with their child?
Yes, certainly. These are things you think about. When you become a new parent, you think about a lot of things. You think about how you grew up, the things you liked, the things you did not like, and all that. I have not come across someone who has walked into the clinic and say that, oh, this is it. I didn't have such a good relationship with my mother, so now that I'm a mother, I'm fearful. But what happens is that the person comes to the clinic with something else. And when you're taking your history and you are delving into what their risk factors could be, and then you realize that they have this intense fear because of the sort of childhood that they had. So that's what happens. It comes up, and then you talk about it, you let them know that probably this is the reason, and then they can be helped. Also, women who have poor social support or no social support at all, it's a very trying period, and you need as much help as you can. So those who don't have that support are more prone to postnatal depression. And then other psychosocial challenges, like when we
Dr. Marfo, psychosocial, it's a big word. Can you break it down for us to understand?
When we talk about psychosocial, we are talking about social circumstances. We are talking about like your living conditions, your economic situation, your relationship with family, with your spouse or the child's father, and then we are talking about its effect on like your psychology.
Yes.
So we put it together, and then we say psychosocial challenges. Yes. So I've already described the circumstances, like economic challenges, because it's a period where you need a lot of money, or even if you don't need a lot of money, you need to have planned financially. Because it's a very financially taxing period. And then living conditions. Some living conditions are quite difficult, and the addition of a child into that circumstance makes things more challenging for people. Somebody may not even have somewhere to live, and now they have given birth, and the weather conditions is not good for the baby, is not good for the new mother, or somebody is living in one room with so many people. So there are lots of social challenges that's going on with a person and with a baby, and that can also increase the risk of getting postnatal depression. And then for those who have in quotes what we call severe maternal blues, that's why we sounded the caution that don't stay home and diagnose yourself. What do you think is maternal blues? Maybe more severe than that. It could be postnatal depression. So these are some of the risk factors. Yes.
Okay. So if they have the maternal blues and they come to you after the 2 weeks, then it no longer becomes maternal blues.
Certainly, it's no longer. Or depending on the severity of the symptoms that the person presented with, we may not diagnose maternal blues. It may be a postpartum depression straight away.